Thank you very much. Good morning. I have to thank the organizers to give me the opportunity to speak today in an important issue that is the molecular mechanism of atrophy and the relationship with the growth stimuli as insulin. So atrophy refers to diminution in the size of a cell, tissue, organ, or part of it. Atrophy, and particularly muscular, is associated with pathologies and disorders like cancer, cachexia, diabetes, sarcopenia, and obesity. So also Prader-Willi patients show a 25 to 37 reduction of the muscle mass. And physical rehabilitation is a common way to counteract obesity and muscular mass loss. And today, I will show you that the physical rehabilitation is inadequate to increase muscle mass in Prader-Willi. And therefore, we went to study the molecular mechanism of atrophy in Prader-Willi, and what we found is that the translational response to insulin is impaired in PW cells. So in the next 10 minutes, I will show you how our project starts, the results, and conclusions. So how our project started? Started with the evaluation of a rehabilitation program conducted at our institute during the period 2006-2012. And 49 adult patients attending a multidisciplinary residential program lasting 3 to 4 weeks for 3 to 4 times a year. So what we found was that the body mass index decreased by 2.6 points on average in patients attending 2.5 cycles. So this result means that our rehabilitation program was effective to control obesity in our patients' cohorts. So in order to better understand the weight loss distributions in our patients' cohort, we look at X-ray densitometry in 8 patients. And so what we found is that the positive variation of the total body mass at the end of a residential session is caused by the loss of fat and the lean mass. So we conclude that our rehabilitation program was capable to control obesity, but ineffective to stimulate the muscular mass growth in condition of normal calories intake. So our data has been published in the Journal of Disability Rehabilitation in 2011, and I have a poster hanging outside. So if you like to have to pose some question, I will be happy to answer about that. So in order to understand what was going on in our Prader-Willi patient, we started to look at the regulation of the skeletal muscle mass growth. So as depicted in this cartoon, the muscle mass growth activated by training depends on a balance between protein synthesis, protein synthesis and protein degradation. So protein synthesis is controlled intracellularly at several levels with a complicated biological network of signaling mechanism. So the most important one is the EGF1, PI3 kinase, AKT, and mTORC1, which I will talk about today. So seeing what was happening in our patient cohort, we hypothesized that the Prader-Willi cells have an imbalanced translational rate caused by alteration in EDGF1, AKT, and mTORC1 activity, which lead to muscle atrophy. So we didn't have a suitable animal model, so we look at in primary fibroblasts, which were derived from skin biopsies or PW patients. And in these cells, we look at the protein synthesis in response to insulin. So, so these fibroblasts were serum deprived for 19 hours, and then were stimulated with 100 nanomolar insulin for 11 hours, and then we measured at a rate of protein synthesis by a non-radioactive test, which is called a sunset assay, which I'm not going to explain about it, but it's a sunset assays measure protein synthesis by a technique that is called Western blot. The quantification of this Western blot is shown in this chart. Sorry, I cannot find the pointer here. So what you see here is that in this chart is that the protein synthesis is not increased specifically in Prader-Willi cells compared to our control fibroblast 175, which indicated that there is a dysfunctional protein synthesis rate in these fibroblasts. So in order to gain insights, the insulin-mediated signaling transduction, we look at first at the activation of the enzyme AKT, which is shown in panel A over here. Sorry, over here. So, so we look at the activation of this AKT after insulin stimulation, and we did that by measuring in Western blot the phosphorylation of AKT at the serine S473 in PW cells or in our control cells. And in the bar chart is depicted the quantification of this in this test. What you see is that when we give insulin to serum-deprived cells, we see an increase in the phosphorylation of AKT, both in a control and in insulin treated in control and in PW cells. Likewise, addition of serum give an increase on this phosphorylation site. These data indicate that the insulin can activate the AKT and therefore transduce the signal. Then we went further. So we know that when AKT is active, then it can act on glycogen GSK3 beta, and thereby inactivating and producing the initiation of protein translation phase. So as shown in panel C, again is a Western blot analysis of the phosphorylation of GSK3 beta at serine 9. So what you see again is that when we give insulin to serum-deprived cells, we see an phosphorylation in these enzymes, both in type of cells, so both in control and PW cells. Indicated that again this signaling pathway is active. When we look at the other signaling sites depending on AKT, which goes to mTORC1 and P70SK1 enzymes, these data are shown in panel D. So what we see is that the phosphorylation of the P70SK1 at the threonine 389 did not increase the phosphorylation of these enzymes, specifically in Prader-Willi. So indicating that the translational response to insulin is impaired, specifically in the axis mTORC1 P70S kinase. So to verify whether this dysfunction was present in other Prader-Willi cells, we look at further in other 2 patients. And again, we look at the phosphorylation of the P70SK1 enzymes. And what you see, similarly to what I showed you before, insulin was enabled to phosphorylate this enzyme. Overall, our data confirm that there is a dysfunctional protein synthesis in this primary fibroblast, specifically in the axis mTORC1 and SSA kinase. So it is known that the branched amino acid leucine can activate protein synthesis via mTORC1 and SP70SK1. So exactly the signaling pathway that was altered in our patient cells. So we wonder whether we could restore the insulin sensitivity by pre-treated cells with the leucine. So what you see again in this chart is that addition of leucine, addition to serum starved cells of leucine from 0.5 to 10 millimolar did not increase significantly the phosphorylation of this kinase. However, incubation with for 15 minutes with insulin significantly augmented the activity of this kinase, restoring the insulin sensitivity in these cells. So what I show you today is that the translational response to insulin is impaired in primary fibroblasts of PW patients, and it is associated with the decreased phosphorylation of a P70SK1. That the dysfunction to insulin response resides specifically in the mTORC1 P70SK1 signaling pathway in PW cells, and our data support a possible molecular mechanism for the muscular atrophy observed in patient. And furthermore, that the branched amino acid and leucine might be a possible treatment for atrophy in PW cells. As last, I would like to thank the FPWR Canada and PWSA USA supported me with research funds and with a travel grant respectively. I would like to thank my foundation, which is active in several in molecular diagnostic, in research, rehabilitation, and is also a clinical center. And as last, all our Italian Prader-Willi patients. Thank you for your attention.